here at the North American Menopause Society National Meeting and Annual Meeting, and we are talking with
Dr. JoAnn Pinkerton.
And Dr. Pinkerton, you are a past president of the North American Menopause Society, and you are also
A professor of obstetrics and gynecology at the Midlife Health Center at the University of Virginia.
And you were talking about, just a moment ago, some new findings, and tell me about that.
So traditionally, the only option for women who have a uterus is to use estrogen combined with progesterone, because estrogen by itself increases the risk for uterine cancer, and the progesterone decreases that risk. But in the Women's Health Initiative, it appears that adding the progestogen is what increases the risk for breast cancer and causes many of the side effects of bleeding and breast tenderness.
So estrogen plus progestin may be less safe than estrogen by itself.
That is correct, and in fact we think that estrogen alone may decrease the risk of breast cancer as opposed to estrogen and progesterone, which increases the risk of breast cancer. So this new product is a SERM, estrogen that's an agonist and an antagonist. It does different things in different tissues.
The so-called smart estrogen.
Exactly, combined with conjugated estrogen into one product so that you have the benefits of the estrogen for hot flushes, night sweats, quality of life, prevention of bone loss, help in the vagina, with a neutral effect on the breast and the uterus, and that's the benefit of the SERM. And this is a unique SERM that is so antagonistic on the uterus that you can add it with an estrogen and you don't need a progesterone.
So it's not just any selective estrogen receptor modulator, but it's a very specific one that's been chosen for its perfect fit with the conjugated estrogen you're talking about.
I think that's the most important fact. You can't take a SERM and an estrogen and put them together unless you test them. And this one, when it was tested, turned out to be effective. It relieves hot flushes and safe. It was neutral on the breast, and it protects against uterine cancer.
So if you were going to the doctor, you heard about this new medication that's out there, this new estrogen plus a SERM, a SERM. What would be the reason you would get that versus something else?
I think the first question is, are you having bothersome hot flushes? Is it enough that you want to take treatment? Are you having trouble sleeping? Are you irritable and tired? If so, then you become a candidate for hormone therapy if you're willing to take it. And then when you look at the question of hormones, it's, do you want to take an estrogen and a progesterone, or do you want to take the estrogen and the SERM? Not all women want to take an estrogen, and not all women are candidates for that, in which case we think about non-hormonals. But if you have enough symptoms and you're a candidate for hormones, then this would be an option. And so let's say you went through menopause and you had a lot of bleeding problems and you didn't want to bleed. This new product has bleeding similar to placebo, which is very unlike the bleeding we see with the traditional therapy. Or maybe you had a lot of breast tenderness or fear of breast cancer. This is neutral on the breast. In fact, it actually has the same effect on breast density as placebo versus traditional increases breast density, which we think is a marker for breast cancer risk. So bleeding issues, breast tenderness, concern about breast density might all be reasons that you would choose the new product over the traditional one.
And this has not been tested in women with a history of breast cancer?
No, there is no data on women at risk of breast cancer or history of breast cancer. So this is just regular women who have menopausal symptoms that are bothersome enough to need therapy. And the data only goes out to 2 years, not been tested in overweight women, and not been tested at women at risk of breast cancer. Some different ethnicities all appear to work okay. Less than 5 years, more than 5 years works okay, but it's a caveat that you only have 2 years of data.
Thank you very much.
Thank you.